Today I'm joined by Ms. Iman Patil, my colleague here in the School of Nursing and Midwifery. Iman is a nurse lecturer, but she's also the level director for level 3. Iman's experience has been in intensive care nursing, and she was also a nursing supervisor before joining here at RCSI. You're very welcome, Iman, this morning.
Yeah, thank you, Professor Catherine.
Could I start by asking you a couple of questions?
Yes, please, go ahead.
I'm interested to know how teaching methodologies have developed over the past years in your time here in RCSI.
Well, working here in RCSI Bahrain, where I started back then in 2012, I've seen a lot of changes when it comes to teaching methodologies. Like back then, I remember we started teaching a didactic method like simple lectures, PowerPoint slides, and then earlier in 2012-13, we started to incorporate the e-book. And that was a big achievement for RCSI Bahrain because among all the universities here, we're like among the first incorporating electronic textbook and moving away from hard textbook, which were really heavy. And moving forward, RCSI did not stop there. We incorporated case-based learning session where we integrate the cases that we learned in a very interactive method where student engagement is very high. And then moving forward with the advanced HE program where faculty started incorporating flipped class learning, using Padlet, everybody now using Padlet there. More technology, we've been using synchronous, asynchronous methodology of teaching. And now also with IPL, interprofessional learning, where we are creating classes merged with School of Medicine and School of Nursing, and where they learn together. And not only there we stopped, we also started at simulation, where we create simulated patients for senior years like year 3 and year 4. We've moved far away from traditional didactic method of teaching to a very unique, innovative, and we're still growing there. I don't feel like we're gonna stop. I feel this is just like a start point for us, and I'm really looking forward of where we're gonna reach as well. So it's like, yeah.
So many changes over the past few years, all for the better, using technology as we have it now. Great. And what do you think are the strengths of this undergraduate program that we're running here in RCSI?
Well, there's a lot of strength here. First of all, it's mapped against the European curriculum, which is a good thing for us. And also in terms of that it meets professional standards, and also in terms of employability, like anyone who graduates from RCSI university is highly recognized. They can be employed anywhere. It's not just in the GCC, it's internationally, they can get a job very easily, which is a good recognition for the graduate as well. And also it provides a lifelong learning for the graduate as well. It doesn't stop there. Yeah,
great.
So today I would like to introduce Professor Catherine Strachan. Professor Catherine Strachan is the head of School of Nursing and Midwifery in the undergraduate nursing program here in RCSI Bahrain. Professor Catherine is a registered nurse and also holds an ED degree in education. Also, she holds a lot of roles across the years in senior positions. She was previously also the head of school in the UK, and also she had a huge role in the quality and assurance department, and also had a collaborative work with WHO. Professor Catherine had multiple publications, and some of them are targeting also in terms of education. So welcome, Professor Catherine.
Thank you.
So Professor Catherine, how has the collaboration framework for the nursing training evolved with the hospital?
So over the years, we have developed very close working relationships with the hospitals. The hospitals sponsor students to come here to train. So we have a memorandum of understanding with each of them. Now collectively there are medical services, and with the Salmania Medical Complex and the primary healthcare trusts. And we recruit students in collaboration with the hospitals to go through the 4-year programme. This is a joint venture that we really need to have with the hospitals to ensure the clinical placements are suitable for the students in training, to ensure that we have clinical tutors available for the training. And I think over the years we've developed from taking a very small intake in the 30s up to now a projected intake of 150 students. Recently we've had a joint venture with the private hospitals, and we are now taking students sponsored by Tamkeen through the Private Hospitals Board, and look forward to more self-sponsored students in the future as well.
That's interesting. As the chair of the Community Engagement Committee, how do nursing students participate in community engagement activities?
I think from the very outset, nursing students are very aware that nursing is not only in hospital, but also in community. And they're very interested in working in the communities in a variety of different ways, ranging from health promotion activities to assisting with charitable work, etc. They engage at different levels, at different years, where we have opportunities available. For example, the Diabetes Mobile Unit, where nursing students, and now more recently medicine students, can join and target schools to give health education to pupils in the school. They can also join in activities through Community Engagement Office, like the beach clean-up, Smile charity, variety of different things that nursing students can do. The opportunity is available for everyone in the programme at the correct stage, and they have to make an application for the privilege of this community engagement opportunities. We also have opportunities abroad, in places like Tanzania and India, and of course in wider areas like UK. So we're now developing a broader engagement with communities and experiences for the students.
Thank you, Professor Catherine.
So what specialties do you think are most attractive to our students once they qualify? Where do you think, or where do you see students going to work?
Here in Bahrain, we have a lot of specialities. Like, for example, we have the new oncology center, which just right in the corner, which that's an area where it requires a lot of students being specialized in oncology care. We have the intensive care unit. We have the midwifery as well, where they work in the pre and postnatal as well. We have the burn unit, we have the neonatal unit. There's a lot of specialty here and high demands where they require speciality in Bahrain. Yeah.
So looking to the future, probably some specialised courses to help these nurses would be. That is something to look at. Yeah. Yeah, of course. Yeah. Thank you. Okay, thank you. Thank you, Iman, for your time.